Welcome to Quick Particulars. This video shares detailed information on heart bypass surgery and technological advancements in this field of medical practice. Also, preventions to take after heart bypass surgery is also discussed in this video. Heart bypass surgery, also known as coronary artery bypass grafting, CABG, is a surgical procedure performed to restore blood flow to the heart muscles when the coronary arteries are blocked or narrowed. It involves creating alternative routes for blood to bypass the blocked arteries, improving blood supply and reducing the risk of heart-related complications. This video provides a detailed overview of heart bypass surgery, precautions to be taken, and recent technological advancements in the field. Heart bypass surgery typically involves the following steps. 1. Anesthesia. The patient is administered general anesthesia to ensure they remain unconscious and pain-free throughout the procedure. 2. Incision. A vertical incision is made in the middle of the chest, and the breastbone is divided to access the heart. 3. Diverting blood flow. A heart-lung bypass machine is connected to the patient, which takes over the pumping of blood and oxygenation while the heart is temporarily stopped. This allows the surgeon to operate on a motionless and bloodless heart. 4. Harvesting graft vessels. One or more healthy blood vessels, often taken from the leg, saphenous vein, or chest, internal mammary artery, are collected to create grafts for bypassing the blocked arteries. 5. Graft placement. The surgeon carefully attaches one end of the graft vessel to the aorta, the main artery leaving the heart, and the other end beyond the blocked or narrowed coronary artery, creating an alternative path for blood flow. 6. Restoring blood flow. Once all the grafts are securely in place, the heart is started again, and the bypass machine is disconnected. The blood flow is restored to the heart muscles through the newly created bypasses. 7. Closure. The breastbone is rejoined using wires, and the incision in the chest is closed with sutures or staples. A drainage tube may be placed temporarily to remove any excess fluids. Following heart bypass surgery, it is crucial to adhere to specific precautions to ensure proper recovery and reduce the risk of complications. Some important precautions include: 1. Medication regimen. Patients are prescribed medications to manage pain, prevent infection, reduce the risk of blood clots, and control blood pressure. It is essential to take these medications as directed by the healthcare provider. 2. Physical activity. Initially, patients may be restricted from strenuous physical activities. Gradually, a cardiac rehabilitation program is usually recommended to help regain strength and improve cardiovascular health. 3. Wound care. Proper care of the surgical incision is vital to prevent infection. Patients should keep the incision area clean, dry, and follow the healthcare provider's instructions for dressing changes. 4. Lifestyle modifications. Adopting a heart-healthy lifestyle is crucial after bypass surgery. This includes quitting smoking, eating a balanced diet, maintaining a healthy weight, and managing stress levels. Regular follow-up visits with the healthcare provider are important to monitor progress and make necessary lifestyle adjustments. Recent years have witnessed notable advancements in heart bypass surgery techniques and technologies. 1. Minimally invasive approaches. Minimally invasive bypass surgery techniques, such as robotic-assisted or keyhole surgery, involve smaller incisions and specialized instruments. These approaches offer reduced scarring, quicker recovery, and potentially lower risk of complications. 2. Off-pump bypass surgery. Traditional bypass surgery involves stopping the heart temporarily using a heart-lung bypass machine. However, off-pump bypass surgery allows surgeons to perform the procedure without stopping the heart, thereby potentially reducing the risk of complications associated with the heart-lung machine. 3. Hybrid procedures. In certain cases, a combination of surgical and catheter-based procedures may be employed, known as hybrid procedures. These approaches allow for a personalized treatment plan, combining the advantages of both surgical and interventional techniques. 4. 3D printing and virtual reality. Three-dimensional, 3D printing technology has shown promise in creating patient-specific models of the heart, aiding surgeons in preoperative planning and improving surgical outcomes. Virtual reality (VR) technology provides immersive training experiences for surgeons, enhancing their skills and reducing the learning curve. Heart bypass surgery, or coronary artery bypass grafting, is a critical procedure that restores blood flow to the heart muscles. Following the surgery, patients must adhere to precautions and make necessary lifestyle modifications for a successful recovery. Furthermore, ongoing advancements in technology, such as minimally invasive approaches, off-pump techniques, hybrid procedures, and 3D printing, continue to improve surgical outcomes and patient care in the field of heart bypass surgery. Thanks for watching.